Thanks everyone for coming. I am a physical therapist and I'm in Missoula, Montana. And a little background on me, I've been a PT, I think, for 15 years now, and I've had a clinic for 10 years, and we specialize in um, people who define themselves athletes. So that can be anywhere in the spectrum, but people who are motivated, working hard, usually playing outside. We specialize in endurance athletes. So we see a lot of people who are across the spectrum in age, but our clinic is primarily female providers, and we do see a lot of women. And so this past year, we started a strength program in our clinic, and we have a women's strength program. And I've been strength training and doing these things for a long time myself. So it's something that I am very passionate about. Through all of what I've done this last year and everything that's been happening and people are interested in right now, I'm just hopeful that I can make things feel digestible and achievable. I just really want to educate and empower women to stay strong. And so I'm so grateful that Kelly asked me to talk today. I want to talk about bone and how we get bone to actually respond to loading. If you're trying to get a bone to respond to a stress or a strain that you're putting on the bone, it needs to be dynamic, needs to be different in some ways. It needs to be a higher load, and it needs to be a short duration and fast and quick. So high strain is required. The first 50 milliseconds are going to be the most osteogenic milliseconds. And so if you're trying to load your bone and you're doing something really slowly, you're probably not going to be as effective as if you're doing something quickly. And depending on where we are in our lifespan, there are ways to do that safely for everyone. And so if I have a young athlete with me, I might be doing aggressive plyometric loading, some power cleans, something like that. If I have someone who is in their 90s, we might be doing a fast sit to stand with some dumbbells. So there are ways that we can load these bones without it being like jumping up and down and aggressive. But it needs to usually be like a higher strain. So it's bigger than your daily activity isn't going to cover it. Sometimes when you go to an exercise class, people might tell you to land softly. And so there will be times that you're going to land softly, and that's going to be teaching you to use your muscles to absorb the load versus landing a little bit firmer or faster, and that's going to be more bone building. And so bone, like Kelly was saying, the strain, the tensile forces that are applied to it, you can really stress out a bone when the muscle contracts. And so that's why strength training is really valuable in addition to things where you're actually getting some impact too. So you want both things happening. Novelty is required. And so you can't do the same thing week in and week out. The best expression for bone is bone gets bored. And so if you have been doing the same exercise, you're like, I'm doing my bone exercises, I'm doing my jump in, I'm doing it in the morning and at night, and I'm checking my box. You're probably ahead of 95% of the population. But if you really want to be effective, you're going to need to change up what you're doing. You're going to need to change the dosage, the intensity, the way that you're loading the bone in order to keep it changing, because your tissue will get bored, it'll stop adapting. So it's really important that either you change it or you have someone guiding you on how to change it a little bit. When we're doing that with people, we're having them change the exercise direction, the intensity, something every 4 to 12 weeks. So it's not every day you need to do something different, but you do probably every month need to be like, I need to mix up what I'm doing here if I want to keep things being osteogenic. I think something that's really good to know after tonight is, especially for bone, is low volume is sufficient. So I think we need more. I see a lot of runners and they come in, they say, I'm a runner. I don't need to do bone loading. I'm jumping up and down, I'm hitting the ground. Your bone was bored after the 100th heel, like foot strike. And so as soon as you hit that number 100, your tissue is, as Kelly was saying, we have our blasts in our class, like our breaker, our builders and our breaker down, and we're starting to break down. We're not building anymore. And so once you hit that number, your tissue is not going to be adapting in a positive way anymore. And so that's not to say that running is bad, but it's saying that it's not checking your box. And so you're going to need something a little different than that. Bone adapts slowly. Kelly was saying how slow it is that you'll turn tissue over. Most bone loading programs that we're doing with people are 6 months to a year. And honestly, everyone should be doing some kind of bone loading their whole life. It should just be in different ways or strategies. This is something that I'll touch on quite a bit more tonight, but site-specific loading is important. And so if you get your DEXA from Kelly and she's talking to you about, oh my gosh, we're seeing some changes that I don't love at your femoral neck, you're going to need some exercises that target the femoral neck. And so if you're doing things that are just going to target your lower limb, it might not be as potent as if we're going to do something to attack the femoral neck. And I'll give you some ideas on what would target different areas tonight too. Multiplanar loading is important. And so tensile loads are really important. And so a lot of people are getting their jumps in. They're like, I'm doing my hop training, but their jumps are like this. Bone needs, like Kelly was saying, for that neck to get some stimulation too. We need tensile load on bone to help bone develop more. And so lateral movement's super important with bone loading. You can't just jump up and down. You need to go side to side. It needs to get some variance in these planes if you really want your bone to build. And then this, I think, is really important to remember, but bone recovery really matters. And so sometimes I'll see people, and this goes along with this bone gets bored, they'll be really dedicated and they're like, okay, I'm going to do more. But more, like I was saying, is not going to be a good thing to do. Your bone, if you do some bone loading exercises and you're really working hard on it and you're doing it twice a day, on Kelly's sheet, it was like, do you do it twice a week? Do you do it 3 times a week, 5 times a week, whatever? And we'll talk about where you should end up in that proper dosage for you. But the important thing to remember is you're going to need 4 to 8 hours between loading. And so if you do your jumping, let's say at breakfast, you might want to wait until dinner to do it again if you're going to be doing it twice a day. You need that 4 to 8 hour period of your bone not getting that same stress applied to it. You should think about that with your running activities and things too. So you don't want to piggyback one on top of the other one. So you wouldn't do your bone loading and then you're running at the same time either, or whatever else you might be doing that's loading your tissue. Energy availability is a huge deal for bone loading. You will not be in a building state if you don't have what she's talking about on board. And so in our clinic, we deal with a lot of people who have REDs and exercise and eating and all of these things that we're thinking about. We're constantly making sure that we have enough to fuel the goal of the task. And so if you're going to be working hard on loading your bones, you want to make sure that you're getting all of these wonderful things in that Kelly's guiding you with, so you have the energy availability.
What's REDS?
Oh, relative energy deficit. And so we see this, like I said, at this clinic, a lot of endurance athletes. A while ago, we were saying, oh, people who have maybe a disordered eating pattern, or they'll fall into these other buckets. But we have some people who maybe don't know how to balance how much activity they're doing with how much fuel they need for their activity. And so we're trying to help people understand the amount that you need. And if you get an imbalance, you may fall into that relative energy deficit. Anyone can, all of us can. It's amazing how much fuel we need, and especially as we get older and we're trying to like hit all of our protein and we're trying to make sure we're getting all of our carbohydrate before our endurance activities, it's actually really hard to get all the food in. It's really important. Then just progressing one variable at a time. Every week we manipulate one variable and then we see how they respond. Then we manipulate another variable, and it makes it a lot easier to understand how the tissue is tolerating whatever it is we're doing. So if you do change your volume in your loading, or you're jumping off of the floor and then you're moving onto a box, just make sure you only do one variable at a time, and so you can understand how your tissue is tolerating that strain. You can correct me if I'm wrong too, but I thought that the top spot was the vertebral bodies for, that's the most common and often underdiagnosed.
That's
Okay.
also the one that can be, it's the most likely to be atraumatic. It can actually just break from holding up the body weight of that person. And so they might just think it's, oh, I have back pain, but they actually have a fracture.
Yep. Yep. And as you start to go forward too, that's why the posture thing is so important. But so if we're looking at the spine and the pelvis, which is, I'm going to say spine is going to be number one, it is really important that we actually get some axial load on the spine. We want some like weight on the spine. I know that, especially as women, our main goal is to continue to be like independent and strong and not get hurt. And so things like a barbell, like behind me, can look really scary sometimes. And you do not have to do a barbell, but putting something on your back, on your body, you can also use dumbbells and placing dumbbells on your body. So they're going to be putting weight back down through your spine. That can be sufficient too. And so if you're going to be targeting your spine, the easiest like strength exercises that we'll do for that are going to be like squats and deadlifts. Like in that Lift More study, they had the squats and the deadlifts in there for that reason. I think deadlifts and squats can look really scary, but they're on a continuum. And I think that's important why you have someone that helps guide you on a good starting point for there, and then you can progressively load it as your body tolerates it well. Those are two ways to load your spine. For the femoral neck and the hip, that would be more of like a single leg load where you're having to you have that pull in a single leg load. So a single leg deadlift, split squats, or step downs. Those are the strength application. For the power application or the speed things, that would be more like a single leg hop, single leg split jumps, things like that. And we can do some of those together here in a minute too. For your spine power loading, that's where people are doing things like jump squats or kettlebell swings or things like that. I see a lot of people with lower limb stress reactions. And so if you're looking at increasing bone health in your lower limb, that would be more like calf raises, single leg loading, those pogos I was talking about that we'll do together, depth drops, step jumps, things like that. Those are like site-specific movements that are pretty common in research too, and also pretty common across the board with someone that you might find to work with who can help you learn how to do those lifts safely for you. And I always encourage people to find someone that they trust, someone that will guide them, someone that will help them get consistent. When we look at dosage of these exercises, like the strength ones that I was just talking about, those are going to be like 2 times a week. And the rep dosage is usually going to be somewhere between like 3 rounds of 8 to 10, somewhere in there. It's not like really time consuming, but it is important that you do the work and you have someone guide you with the work. I think the main thing that matters is you have someone help you set up a program for you, and then you figure out what's going to work best for you. Like I was saying, in Missoula here, we have group classes, and some people love group classes. Some people do not like group classes and they want to do their own thing at home. And if you know that about yourself, then you want to have someone help you design that. If you know that you would rather be guided one-on-one, then you want to make sure that you find someone to work with you one-on-one and help you be successful that way. But in the world of PT, we're constantly trying to identify the barrier to why it didn't work out, like why we weren't able to establish the routine or whatever. So it's good to know the type of person you are and what works best for you. And so it can be tailored for you. When we look at like training and building resilience, muscle, bone, like all of those things, your tissue does fine with progressive overload of the same exercises to a point, and then you'll hit a little stall, and that's usually around like a 6 to 8 week period, and then it just needs a tiny shift, and then it can go like progress again. So you don't really have to change things dramatically. It's these tiny little things, whether it's in like the dosage of it or the speed of it, or maybe you do a different type of hinge, but it is really nice after that like 6 to 8 week period to give your tissue a little guessing game. If you haven't been doing some bone loading, we won't start people at that dosage. We'll usually ramp them into it. And so they'll be starting it like a couple times a week. How did that go? We'll bump it up a little bit more, and then we'll bump it up a little bit more. Because the contacts are so short, it's like we're doing like 30 in the morning, 30 at lunch, and 30 at night. It's not a big deal. They just kind of like jump a little bit, and then do a little bit. It shouldn't feel like it takes a lot of time. But we'll usually be mixing like pogos, lateral hopping, and then some lateral bounds and some depth drops. I'm going to stand up and demo some of these. I'm going to talk about how we do some of these movements. The pogo hops that I was talking about, the thing that we want them to be is we want them to be like snappy and crisp. And so when you jump, you don't actually want to be like this. You want it to be more like, so you can see how I hit the ground and I get off the ground. So it's stiff, reactive. And you're gonna, if you haven't been doing these, you'd do like 10 of them the first time you did it, and then you'd stop. And that would be it. And maybe you did that in the morning and at lunch in the evening, or you could start with twice a week and then build it up. But they're really, really fast and snappy. But that would be like a level 1. If someone, let's say someone's bones don't tolerate jumping and that doesn't feel good. So the way to regress that, if you want it to be easier, if you do go to a gym and they have like assisted pull-up bands, if you guys have seen these, you can pull down on that and it'll offload your body weight. So you can do that. Or you could go to a bar and hold on and offload your body weight, and that will deload it. Or you could start with something as simple as a scissor. And so you're gonna do something like that. So that'll decrease the impact loads, and it might make it a little bit more tolerable as a starting point. If you thought the pogo hops were easy and you wanted something that would be a level up from that, that's when you would start to add height to what you're doing. And so you'd be going up, down, and up, and down, and up, and down, instead of just going up and down. Yeah, so up and down on a surface will increase that. If you wanted to make it even harder and you had been doing these pogo hops for a while, that's when we would go to single leg. But I would say if you think about that dosage, I just went and increased your dose 100% because you went from half to double. And so I always tell people single leg loading does not need to be done for a long time, maybe ever. You might not need that much stimulation, but that would be the progression of it, to start out easier and then to get a little bit harder with the pogo hops. Some other exercises that people are often doing are going to be we could do depth drops off of this guy or this guy. And so when you hit the ground, there are two things that we want to practice. We want to practice hitting the ground, and then we want to practice getting off of the ground. And so if you're going to do a depth, you'll go off of something, you'll land, and then you'll explode out of it. So not only are you getting the impact load of hitting the ground, you're also getting the muscle reactivity of getting back off the ground. So you get that stretch bend. So you'll go here and then jump. And so you land and then jump. And then if you want to make it harder, you go off something like a plyo box where it's like a big jump and then down. But those would be like higher level. That's not necessarily something that you have to do, but it's something that would continue to strain the bone if you needed additional strain. I think the easiest way to think about it is start double leg, work your way towards something that's going to be single leg. The one that I didn't do that I think is really important to do too are laterals. And so the easiest lateral is a double leg lateral. And so if you're going to do a level one, you're going to start 2 legs and you're just going to do these. So side to side loads.
Fine.
Yeah. You'll get lateral there, and it'd be the same count. Yep. If the laterals in that plane, you're like, oh, that's pretty easy. That's not how people go from right to left. So you jump from one leg and you land on the other leg. And then if people really want to get fancy, that's when they start going single. That gives a really high load in these planes that I was talking about. And so it can be really effective. I think that with strength training, with bone loading, the main thing is nailing the dosage specific for you. And so I see people have problems with strength training or bone loading when things got too hard too fast, and they strained it in a way that actually truly strained it. So I think with all of these things for women who are aging in this like perimenopause, menopause place, the goal is you never have to take a week off because you got hurt. Because if you get hurt, if you get a bone injury, if you fall, if any of those things happen, that's when we see the massive decline. And so in my world, my main goal with all of my patients is to never let them, I mean, things are going to happen, but I'm always trying to be like, how can I keep you durable? And so your goal isn't to go hard with this, it's to start. And it's to start easy, and then it's just over time to like sprinkle a little bit of extra on. And if you ever feel like you're at a place where like this exercise actually just feels really hard, you probably don't need to sprinkle a little on. Maybe you just need to change whether you're jumping forward or backwards or side to side, but it's not like you actually need to advance to a box jump. That might not be appropriate for where you're at in your stage of life. When we look at doing these exercises, whether it's strength, balance, or bone loading, we think about it in the context of the human who's in front of us. And so when I'm looking at these like young kids who are just going through puberty, I'm making sure that they're eating enough, they're getting enough nutrition, they're building that bone mass for long term, they're getting their period when they're supposed to. We're emphasizing jumping, sprinting, moving fast, all those things. And then as soon as everyone starts moving to this midlife stage, we start being like, you need to get really strong. I want you lifting weights. I want you comfortable lifting weights. Take up space, have someone guide you, get really strong. And then as we start to move into this older stage of life, that's where I'm like, you cannot fall. You are going to do your balance exercise. We're playing defense. We're like, hopefully you built the bone muscle up because or not the bone and muscle up, because if you lose muscle, that makes you more likely to fall. So that's the other reason why you have to lift weights and you have to eat all the food. So all the things like work together. And so you change your focus a little bit with wherever you are. So meet your tissue right where it's at. And then it's really good to have a guide help you, figure out what's going to be best for you. Yeah.
Was always under the assumption that in order to build bone, you need to do heel strikes. So I was watching how you did your, what did you call them? The
Oh,
pogos?
goes.
And you were not striking your
No.
heel.
Yeah.
So what's up with that?
You don't. You do not have to do a flat foot hit, yeah, for bone loading to occur. On that same note, like I was saying, I deal with a lot of people who have stress reactions, and I can't even do strength training with them when they have a bone stress injury because of how much the muscle pulls on the bone. And so we're sitting here being like, you have to hit the ground hard and hit it with a flat foot. If I have someone do a calf raise, that's enough to stress their bone out. And so whether you hit the ground with a flat foot on your forefoot, you're still going to load bone. If you're having pain hitting with a flat foot, that's all the more reason to be like, don't do that. I think that there are some people who will tell you need to hit the ground hard. That's been put around right now. And that's what I'm talking about with the like stiff, fast, quick reactivity. You need some impact load for sure, but you do not need to be in a locked out stiff position like that to get effect off of it. I think it's good to know that too, because if you have pain with some of those things, it's like, it doesn't have to be quite like that, but it does need to be like, it needs to be crisp, if that makes sense. It needs to be a quick, fast hit. And then you look at places like OsteoStrong where they're having people simply push on a machine. I think everyone's going to have their opinion. Someone's going to tell you like this doesn't work, but all of these things are putting stress on that bone and are going to build that bone. So maybe sometimes you do it one way, maybe sometimes you do it another way, but there isn't one way to do it. And so feel free to like vary it and do different ways. But yeah, you don't have to hit the ground with a flat foot to stress your bone out. There are a lot of ways to do that.
I have two knee replacements, and so I have a lot of pain with a squat and stuff. And so that gets hard.
So the good news is there are a lot of ways that you can load the bone that aren't squatting. And so it depends on like which bones you're trying to load. And if you're like, gosh, I'm really trying to load my femur. Let's say your femoral neck was a little low, especially from being non-weight bearing, following both of those total knees. That's why I'd be like, well, if you're doing a single leg RDL, that's a hip exercise. You're doing this movement. And so then you don't have to like stress your knee out as much while you're doing those things, but that's a way that you can still put some strain on that bone. And you do not have to have these like impacts to load bone. That's kind of what I'm saying too. Like I love it when people can jump around and load their bone like that. Plus I love it for their tendons. Plus I love it because then they stay fast and those are all really wonderful things. But if it hurts, then it's good to know that you can still load your bone. And that's why the heavier strength training can really be beneficial because that bone is going to, or that muscle is going to tug on that bone, which is going to make that bone respond osteogenically too.
So I know Kelly talked a lot about estrogen therapy and hormone therapy and menopause. Have you seen any changes in your patients of people who are on hormone therapy versus not, and their progress and what happens to their bone strength and density and just overall muscle strength?
I love this whole world of like hormone therapy and actually helping women right now, but I still think it's like in its infancy. And so a lot of the benefits that I will see are women actually come to PT demanding strength right now, which I love. Women have less joint pain when they're taking the hormone replacement therapy. They'll sometimes be like, wow, that made it go away. And we're like, yay, that was the problem. And so I see that at this point, as far as DEXA comparisons pre and post, I don't see that yet because a lot of women, they take 2 years in between their DEXA. And so they may have just gotten one and got their numbers, but they haven't had like a second one yet. It's not new, but unfortunately kind of is new as far as women demanding more of this and paying more attention to it. So yeah, but I definitely see less joint pain and yeah, people wanting to be stronger, which I love. Yeah.
Kelsey and I have definitely seen improved bone density within 2 years. Even if you're like maintaining and you're not losing as much, that's still like, that's such a win when we think about a woman in a postmenopausal state losing 20% of her bones in 5 years.
And I will
So,
say the DEXA pre and post that we have seen have been that. Because we do have patients who come in with DEXA scores and then they do their PT and then they get another DEXA gun. And it is so amazing to see it improve because I think for so long we were like, well, that's what you got. You're on your downward slide from here. And we have women of all ages, and it's so cool to see them come into the clinic downstairs and they're coming in on their own time and they're just like lifting weights. And it's so cool. Yeah. So I think at any point in the game, it is never too late, just to show up and start like trying to move some weight around is really a good thing. Yeah.
Two of my staple movements are like squats and deadlifts. What would that actually look like to vary it? Is it changing up my exercises, the weights, the speed, all the above?
So when we do programming, our two primary compounds that we'll manipulate are a squat and a hinge. And so when we're manipulating our squat, sometimes it'll look like a barbell back squat. Sometimes it'll look like a barbell front squat. Sometimes it'll look like a cyclist squat with dumbbells. Sometimes it'll look like a different dosage on the barbell back squat. So a 4x6 or a 4x8 or, the numbers and the weights. Sometimes it'll have like a pause in it. Sometimes they'll have speeds, will change the tempo of it. And all of this, I think, sounds like, oh my gosh, this is so overwhelming. But the good news is just do something and make it a little bit different and it's going to be great, And so from the hinge perspective, that's where we do our deadlifts, our hip presses, our single leg RDLs, we do bent over rows, things like that. And so I think the world of programming is really it's fascinating and I love it and it's really fun, but I also feel like it can shut people down because they're like, oh my gosh, you just made that way harder than it needed to be. And so, yes, variety is good, but the most important thing is that you do it. Just make it a little bit different and you're going to be doing just fine. I'm the type of person who I like a lot of variety. And so I do different programming and I like that, but you don't have to do that in order for it to be effective. In our clinic, we're going to take what we're doing here and we're going to turn it into an app. And so people can then be told what to do because a lot of people like being told what to do. And it's a way for us to help people who don't live in Montana or don't live in Missoula. And so if anyone is interested, I can let people know too. But I do think as women, we don't want to have one more thing to plan. It's nice to just show up and do the thing. And so it's nice to have a guide. And that's why also, if you don't feel comfortable lifting weights, I'm like, go find a PT that does this kind of stuff or a trainer that knows their stuff and have them guide you. You deserve it.
when I was young, Jamie told me, you and me were talking about gym memberships, and I'll never forget. You were like, no, the gym membership expense isn't an expense. That is the investment in your health that pays off tenfold. I think you told me this when I was like my 20s, and I've thought about it every single time since whenever I've thought about if it's worth it or not. Oh, it's $100. I can't afford not to.
Yeah. And I do think figuring out what works for you is so important. I have a gym membership too, and I go there because I like the community. And so it's just finding the things that really fill your cup.